Premier Orthopedic practice came together as an association of other private groups in the area over the last 2 or 3 years. For me, I was one of the early ones in, and we really were searching out talent, integrity, and people who are good value to the community. So we now have a group that expands from Middletown, actually as far south as northern Cincinnati, through Piqua on the north end, as far east as Jamestown, and as far west as the Indiana border. So the value to our practice right now is we cover multiple different specialties in a huge geography. I think there's a couple of values to being in a large group like this. If you have a foot problem, we have a guy who specializes in foot problems. If we have a hand problem, we have people who specialize in hand problems. The nice thing about that is, for myself, is if there's something I don't do or don't do often, I have guys I can pick up the phone and call, and we will get you to the right people. I think what can set you apart is, one, are you getting your patients in? Are you giving them access when they need you? I think we do that as well or better than anybody around the Dayton area anyway, and maybe anywhere. I said the other thing we have is we try to figure out how to cover things comprehensively so that no matter what your problem is, we take care of it for you. Our primary offices in Premier Orthopedics have been established into the healthcare system in a way that puts us into geographic locations or buildings that provide comprehensive care even outside our practice. For example, if you see me and you have a therapy need at Good Samaritan North, I can send you downstairs for therapy services before you leave the building. If you need advanced imaging and MRI, we can send you downstairs in the building before you leave and schedule your advanced imaging. They can have a packaged up plan before they leave the building that day. They'll see me, they may get to see the therapist, they may have their MRI set up. We have a pharmacy on site, so if they need medication, they can pick that up, and as they're walking to their car, they have a comprehensive plan already arranged. I am a Southwest Ohio born, bred, been here all my life. I grew up in Middletown, Ohio, went to the University of Dayton. I did travel south to Cincinnati for med school and did make a little bit of trip out to Virginia for my residency, but came right back. So I spent 4 years at Wright-Patterson Air Force Base, where I started to reestablish my roots in the community. Found a great opportunity out here with my lifelong partners, Dr. Brown and Dr. Miscali, who mentored me through the early parts of my career to get me to understand how to run a practice that's good for people. And I think that has evolved to where we are now with a Premier Orthopedics group who has continued to develop a philosophy of patient first. And I'm absolutely loving it. I couldn't imagine myself being anywhere else. Every once in a while you wonder if you're in the right spot, and I can tell you right now I'm exactly where I'm supposed to be. My job has given me access to my community. So being an orthopedic surgeon in sports medicine puts me in connection with a lot of the youth in our town. And while 15, 20 years ago I didn't understand what the value of that was, I can tell you that over the years I think they contributed as much to me as I contribute to them. I've also been very fortunate to be a part of the University of Dayton sports medicine team, probably dating back to 2001 or 2002. And being a graduate of the University of Dayton, that's been just fun.